Hi everyone, it's Bridget Collins here again, and I'm with the lovely Alice Henderson, clinical physiologist, scientist. I'm not quite sure, but I know it's something that we wanted to discuss and talk about a little bit further. So welcome, Alice. Thank you for coming in today.
Thanks for having me.
It's a pleasure. So clinical physiologist, scientist, which one is it? And I'm unsure what either of them mean.
So they're very similar, and they actually both the roles do kind of merge together to a degree. I think the clinical scientist, they do lots of everything that a physiologist would do. So they see the patient, have mostly a purely diagnostic front to their role, whereas the scientist will have the physiologist role, but then they'll also do a lot more the scientific aspect, so troubleshooting the machines, because all the machines that we use for the diagnostics for lower GI are very technical,
Right.
and there's quite a bit to it. So I think they have that aspect of it, and there's also a degree of leadership as well, management as well, within that. But there is a lot of blurring of both the roles, and they do.
Okay.
They come part and parcel, more or less.
Yeah. When I was at St Mark's, I worked very closely with clinical physiologists, and their role was very different to yours. So they were purely diagnostic, but I know your role is quite unique because you do diagnostics and treatment. Can you tell us a little bit more about that?
I think when we see a patient, we have a full hour with them. So we'll see them do a really detailed clinical history, so we'll really understand what's going on. We'll then go on to do the diagnostics, and then go through the results with the patients, but then also it would feel a bit weird just to send the patient off on their way and then refer them to somewhere else. You want to complete the process,
Yeah.
and when the patients come in, they are quite distressed. They want an answer straight away, and they want a treatment straight away, and it's nice to be able to give them it, whether or not they're just conservative changes that they can make to their lifestyle straight away, or the irrigation as well. That was something we can give them to take home, and they can give it a go, and they feel like they're becoming accountable for their symptoms, and they're trying to change. They're trying to do something to make their lifestyle a bit easier and manage their symptoms.
Yeah. It's quite a unique role though, isn't it? Because I know I've worked closely with nurses and physiotherapists, and we've often said there's a bit of a blurring of those roles as well. But clinical physiologist is so unique. It's almost like streamlining a service, preventing that referral from one department to another department to another department, which actually works out really quite well. And I guess it makes the patient get to be seen a lot earlier.
Yeah, I think a lot of people's aim is to create these one-stop clinics where they get seen, they get their diagnostics done, and then they get sent. I can give them a few tips and to crack on with, but then also send them straight over to the physiotherapist or the biofeedback nurses, people like that, so they can just get it all done in one go, reduce those hospital touch points, that sort of thing. And I think the patients are really appreciative as well.
So they don't have to have multi-appointments.
Yeah, it's
basically
confusing as well. You're always getting so many appointments through, some get cancelled, and if you just have it all in one go, it's just so much more efficient, so much better for the patient.
And I guess as well, they get to develop a really good relationship with you. If it's just the one person seeing them for diagnostics, treatment, do they come back and see you for further follow-up treatments?
So typically we would do a telephone follow-up, but then sometimes they can come in as well. The way we quite like to do it is they can just drop in if they want to. Because sometimes they might be using low volume, and then they think, actually, I need something more, I need high volume. So then you can bring them in, and rather than waiting, for them to then have to be re-referred, you can just get them in straight away, and then we can send them on their way, just so they get having a kickstart straight away.
Yeah. Thank you so much for coming in today. It's a great conversation. Really enjoyed it. Hopefully we'll see each other soon.
Yeah, hopefully. Thank you for having me.
Pleasure.